Hello everyone, Australian physiotherapist Mr. Lee here. Today I'm going to be talking about the root cause of the shin splints mentioned in the last video. It can also be the root cause of almost every musculoskeletal problem, so stay tuned. There are two things that I will address. 1. Hip muscles and 2. Body rotation. Lots of people were born with flat feet, but everyone's foot arch can go lower anyway, and it can be the starting point of many problems. Your foot arch lowers 1. When your side hip muscle is weak, and 2. When you don't rotate your body. We will take a look at the first reason, weak side hip muscles. This muscle is called the gluteus medius, which stabilizes your pelvis when you walk. When you stand on your right leg and have a weak gluteus medius, your left hip will drop as your right side doesn't do its job. Then, the center of your body will lean towards the midline. What if your glute med gets weak or tired quickly when walking or running? Again, your arch will go lower, which is why people with a normal arch can also have flat feet, and that affects the whole body's mechanics. The second reason for functional flat feet is the lack of body rotation. Stand up and rotate your body to one side. Then you will notice your foot arch goes up on the side that you rotate. It's the same when walking. When you take a step forward, you rotate to that side and your arch will go up. That means your weight will be evenly distributed all through the outer side of your foot. If you don't rotate enough, your arch goes down, which causes functional flat feet. This is why you need to rotate your body when walking or running, with arm swings and wide strides. I would like to mention one more thing, weak gluteus maximus. Its main function is to push yourself forward when walking, and you need to be able to feel its contraction when walking. If you don't, then your calf and hamstring muscles will be used to push you forward instead. This is why you always get tight calves and hamstrings when you walk for a long time. The first exercise that I'll show you will activate your gluteus maximus. Stand one step away from the wall and do the lunge position. Tuck your core in and keep your spine straight. Then, as you straighten your right knee, bring your left knee to the wall and squeeze your right hip muscle whilst doing so. Lift your arch a little bit so that you put more of your weight onto the outer side of your foot. Start with your right knee bent and straighten as you go forward. It is the same as walking, and you are training your muscle in a walking pattern. Bend and straighten. We are basically trying to activate your muscle in a similar way it is going to be used. Lift your left knee higher if you can't feel much, or embrace your core more and tilt your pelvis down. Don't lean forward and aim to do 3 sets of 10 daily. It is best to train your muscles in the weight that it is going to be used. Your lower limb muscles especially should be trained in walking and running. This exercise will be for your side hip muscles. Again, I'm working my right side in this demonstration. Stand right next to the wall and bend your left leg up to 90 degrees against the wall. Then, push your left knee into the wall and put more weight on the outer side of your right foot. Tuck your tummy in and squeeze your hips, and don't bend your standing leg. Hold that position for just 10 seconds, or if you are able, aim to do it for 1 minute. Do it as long as you can, 2 to 3 times a day. If you don't feel your side hip working, here is the easier version. Put your hip instead of your knee and drive your hip up against the wall. Don't bring your hip backwards and drive your body a bit forward instead, so that your hip is placed ahead of your body. Then you should be able to feel that gluteus medius muscle working. This one is for all you runners out there. Again, we are going to mimic our running pattern. The starting position is the same as before. Keep pushing the wall with your left knee and bend the right knee up and down. As you lower, bend your right knee and straighten it back up when you come back up. This will burn your gluteus medius. I mean it. Be careful not to bring your knee inwards. If you push your left knee into the wall, your right knee will automatically face forward or slightly outwards, which is good. Also, do not lean your body towards one side and try to keep it straight. Aim to do it for 5, 10, 20, or 30 seconds and eventually build up to 1 minute. You can use a pillow or something similar to slide better. You also need to do some toe exercises to lift the foot arch. Here are some that you can try. 1. Grabbing the ground with your toes for 5 seconds. And 2. Lifting your big toe for 5 seconds and resting. It can also help with your hand if it is too difficult. This prevents your arch collapsing when you run. This is why you need to understand your pain can come from different parts of your body, especially the spine and pelvis. Believe it or not, this is the root cause of many musculoskeletal problems, which is going to be repeated over and over. Therefore, walk with your arms swinging and take big steps so that you can activate your glutes and your spinal muscles better. That's how you walk and run properly. I hope that this video helped, and if it did, please subscribe, like, and share, and leave comments down below. Any feedback will be greatly appreciated.